National Skills Coalition webinar, Developments in Skills-Based SNAP ENT. I'll turn you over to our Senior State Policy Analyst, Brooke Durensis, and we can get started.
Hi everyone, I'm Brooke Durensis with the National Skills Coalition. Thank you for joining our webinar today. We're going to spend this webinar discussing key developments in SNAP employment and training as a skill building program. And I do just want to mention that in the past, National Skills Coalition and Seattle Jobs Initiative have worked together to conduct webinars on the topic of skills-based SNAP ENT programs, and those webinars are archived on National Skills Coalition's website. Today, we're really going to go beyond describing key components of skills-based programs to discussing how states are aligning their SNAP ENT programs with key state workforce development initiatives, as well as with WIOA, to create pathways to credentials and careers. Next slide, please. So in terms of the agenda, I'm going to start by providing some context for skills-based SNAP ENT developments. Then I'm going to turn it over to David Kaz from Seattle Jobs Initiative, who's going to share key findings from 2 recent reports. Then I'm going to moderate a discussion with folks from 3 states on key developments in their states, and then we'll open it up for audience question and answer. Before I get started on the background and context, though, I'd like to just introduce the other speakers. Next slide, please. So today we're joined by a fantastic panel. In addition to David Kaz from Seattle Jobs Initiative, we're going to hear from 3 speakers who are going to share their state's experience. So we have Louisa Erickson from the Washington State Department of Social and Health Services. We have Sarah Mumford from the Maryland Department of Human Resources. And we have Denise Thomas from the Tennessee Department of Labor and Workforce Development. Next slide, please. So just some context for today's discussion. SNAP Employment and Training is a federal program that's administered by the U.S. Department of Agriculture's Food and Nutrition Services. The aim of the program is to support employment and training activities to increase self-sufficiency for SNAP participants. Now, SNAP ENT can be used to expand opportunities for low-income people to build their skills, and it has a lot of potential to do that. But few states have realized the full potential of SNAP ENT as a skill-building program. But that's starting to change. Over the past several years, Washington State has developed a statewide skills-based SNAP ENT program called BFET, which stands for Basic Food Employment and Training. And this model from Washington State really provides an example to other states on how they can use their SNAP ENT programs to create meaningful skill-building opportunities for participants. In addition to having this strong state model, federal policy is creating more of an imperative for states to use SNAP ENT to help participants build skills. So in 2014, the Workforce Innovation and Opportunity Act passed, which we call WIOA. When that passed, it created new opportunities for SNAP ENT to partner with other workforce development programs in their state. States had the option to create and implement combined WIOA plans that explain how they would align SNAP ENT with education and training services provided by WIOA. WIOA also emphasized the need for states to develop strategies for coordinating services across programs to better serve low-income people. Under WIOA, 10 states officially included SNAP ENT in their combined state plans, and others discussed SNAP ENT as part of their overall workforce development strategy, and we'll be hearing more about that on today's call. Another change in addition to WIOA was that in 2014, the Obama administration directed federal agencies to make training programs more job-driven or responsive to the needs of employers with available jobs in the labor market. And in response to this directive, Food and Nutrition Services issued a communication to state SNAP agencies urging them to make ENT programs job-driven. And they listed a number of actions that states could take to do that, and these included things like creating opportunities for participants to earn employer-valued post-secondary credentials, promoting practices like contextualized learning, dual enrollment in adult education and post-secondary education, and bridge programs, providing robust support services, and developing partnerships with organizations like community colleges, community-based organizations, American Job Centers, adult education providers, TANF agencies, and the like. So in addition to issuing this letter, FNS also has launched SNAP to Skills, which is a technical assistance project being led by Seattle Jobs Initiative to support states in their efforts to move towards skills-based SNAP employment and training. So this is all to say it's within this context that the two reports that David's going to be talking about and the efforts of states we're going to be hearing about are happening. So in terms of the two reports, one of our reports, which was jointly issued by National Skills Coalition and Seattle Jobs Initiative, focuses on recommendations from lessons learned in 4 states who received technical assistance to move toward a skills-based SNAP ENT program. This report, which was made possible with the generous support of the W.K. Kellogg Foundation, includes lessons learned from Maryland, and we'll be hearing more about that from Sarah Mumford, who's on the webinar today. The second report, which was issued by Seattle Jobs Initiative and made possible with support from the Annie E. Casey Foundation, really focuses on SNAP ENT opportunities for alignment with WIOA and includes lessons learned from both Washington and Tennessee, and we'll be hearing from representatives of those states today as well. So with that context, I'm going to turn it over to David, who can give us an overview of key findings from both reports, and then we'll get our discussion started with the states. David?
Okay, thanks, Brooke. So SGI engaged in 2 separate projects. They're closely related around SNAP ENT in 2015 and 2016. They both involved providing technical assistance to states to help jumpstart their skills-based SNAP ENT programs. And both projects, as Brooke was mentioning, involved a sort of a research and writing component related to SNAP ENT. So if we can go to the next slide, please. There we go. So in the first project, the goal was to work with 4 states, which you can see here, Connecticut, Iowa, Maryland, and Oregon, to begin to build skills-based ENT programs and really focus on helping them expand the effective use of 50/50 ENT funds, and doing this by utilizing partnerships with third-party providers, all to help SNAP participants to gain more skills, combined with supportive services that SNAP ENT fairly uniquely among programs can robustly support, really to help people move to self-sufficiency. Each of these 4 states was starting in a different place with its SNAP ENT program and had different objectives for how it wanted to grow, as well as some unique challenges. But there were also some common themes that helped shape the work that we had to do in all 4 states. And you can see those here. They really included a need for more in-depth understanding of SNAP ENT and its potential at multiple levels, both at the state level and among potential third-party partners such as community colleges and community-based organizations. So really kind of giving them a high-level knowledge as well as the nuts and bolts depending on who the audience was. Another need was a need for champions. You'll hear some of them on the phone today, but it was really important for each state to have a champion and really a vision for what the SNAP ENT program could be, that these champions could sell to leadership and a variety of different stakeholders to sort of push things forward. Another sort of common theme was a need for capacity within the state to see through both the planning and development required for an expanded SNAP ENT program, as well as creative ways to find that capacity. So this is new work for a lot of states, so they needed additional capacity to carry it out, and figuring out ways that they could find those staff and resource capacity to do that work. A 4th thing was really a need to put structures in place to support program growth, from everything from an MIS system to track participants from enrollment to outcomes or exit, to support reimbursement, to potential third-party partner assessment tools, contracting procedures. A lot of things had to be put in place in order to support a larger SNAP ENT program. And then finally, sort of a common theme was a need to identify potential third-party partners and matchable funding streams that could support the growth of a 50/50 ENT program. So those are all the areas that we worked on with states, among many others, but those are sort of the common things. Next slide, please. So what we learned in working with the 4 states in these and other areas, and really documented in the brief that I believe there's a link at the end of this PowerPoint, were some important lessons that we hope can help efforts to build skills-based SNAP ENT programs in other states. So these sort of lessons were, first, in order to build and expand the skills-based SNAP ENT program, there really has to be buy-in from multiple stakeholders, and obviously the most important among those is the state's SNAP or SNAP-E&T agency and their leadership, but certainly beyond that as well. One important way to do that, as I alluded to, is to start early by developing powerful vision for what the program can be, and then really identifying the strategies and resources needed to support that vision. A second thing, some of the most critical of these resources that states need, as mentioned, are the staffing and infrastructure to support both planning for an expanded program and operating an expanded program. And states may need to be creative about how to add capacity. A lot of states are handcuffed in terms of whether they can fund sort of new staff. So some options include taking advantage of outside resources that are being developed by other states and sort of repurposing those, or utilizing information from the FNS Staff to Skills Project, FNS regional offices. Another strategy, as Maryland took was really thinking about repurposing part of the 100% SNAP-E&T program grant funds to support new infrastructure needs, and moving towards using 50-50 funds to support services to participants, or taking advantage of other structures such as Tennessee did with its one-stop system to really support SNAP-E&T as well. Third, because SNAP-E&T can be complicated to administer, particularly at first, states might consider starting small through pilots, perhaps focus on a specific geographic area with a limited number of partners. Doing a pilot, there's a lot of good reasons. Importantly, one of them is to really work out the bugs before kind of going broader and more visible within your state, and also to really build support for further expansion. As pilots are successful, states can sort of get support for doing the infrastructure additions that they may need to support a bigger program. Fourth, states can build on existing workforce development strategies and programs. So SNAP-E&T can connect to, and 50-50 funds can be leveraged utilizing existing workforce initiatives and funding streams, such as EARN in Maryland, as you'll hear about, or BFED in Washington. And it can build on individual college and community-based workforce programs that have already demonstrated success. So in short, state SNAP-E&T agencies don't necessarily need in-house expertise on workforce, nor do they need to build their own programs from scratch. They can build on what exists and what works. Next, matching funds are obviously important in building skills-based SNAP-E&T 50-50 programs. So states may need to take steps to identify these funding sources and the agencies, colleges, and community-based organizations that are investing these funds. One option is to develop a resource map to identify what these funding streams and potential partners are. States can also seek to utilize the potential of SNAP-E&T match to attract new investments from government, state government, or philanthropy. And finally, and I'll talk about this more with regard to the second project, it's important to align skills-based SNAP-E&T programs wherever possible with other workforce programs and initiatives such as WIOA, Pell, and TANF. This can help create seamless transition points for low-income individuals between programs in a way that will ideally allow them to continue to advance their skill levels and jobs and earning prospects, including through career pathways models. Next slide, please. So in the second project that I mentioned, which was completed this year, we did two things, both related to furthering the building of robust skills-based SNAP-E&T programs, but this time with a focus on alignment of SNAP-E&T with WIOA and the American Job Center or one-stop system. And the first part of it was we worked to provide technical assistance to Tennessee on building its SNAP-E&T program up. I won't say much about the Tennessee work here because Denise is on the webinar and she'll share with you a little bit later. And you can certainly access our paper, which provides a detailed case study of Tennessee's great work. But we selected Tennessee to work with in this project because there was really a clear opportunity to integrate SNAP-E&T and WIOA, as both were run through the state's Department of Labor and Workforce Development, which was already sort of advanced in thinking through strategies to integrate multiple programs and funding streams, particularly for low-income and low-skill individuals. In addition to the technical assistance to Tennessee around SNAP-E&T, as shy was through research trying to uncover the impact that WIOA and specifically the charge for states to develop new workforce plans that would better coordinate services to serve low-income people, how that might impact skills-based SNAP E&T programs, either positively or negatively. And this slide shows the primary research questions that we were looking to answer. So on the one hand, as mentioned, it's pretty clear that it can be very beneficial to job seekers when programs are aligned or integrated. And states had the chance to do this with SNAP E&T, as Brooke mentioned, by including SNAP E&T as a partner program in a combined plan under WIOA. But on the other hand, there was really concern among advocates of strong skills-based SNAP E&T programs that because there's still so little understanding of SNAP E&T's potential in many states, that WIOA would be a cause for states to simply look at SNAP E&T as a funding source and subsume it underneath the WIOA system and use it for the usual one-stop activities. And this might mean that it might translate into not building a strong SNAP E&T program that makes use of third-party partnerships, or one that's focused strongly on skills and training, or one that utilizes 50-50 funds to provide robust support services for the hard-to-serve, or one that builds new collaboration between government, colleges, nonprofits, and philanthropy. These are all things that a really robust SNAP E&T third-party model can do, and there was concern that perhaps WIA would sort of truncate that, that possibility. So next slide, please. So as we reviewed the WIOA workforce plans of the states, as Brooke mentioned, we found that just 10 states had submitted combined plans that include SNAP E&T. A few had unified plans that briefly mentioned the program as part of an overall strategic approach. But of the 10 combined plans, really the plans themselves gave very little detail on how the programs would be aligned. And one key reason for this, as we spoke to states, was simply the lack of time or guidance in the planning process to work out the details of what alignment will look like. States, for the most part, simply added their SNAP E&T state plans into their combined plans kind of at a wholesale level. So the punchline for now is that we really don't know yet the immediate direct impact of WIOA on SNAP E&T, but it seems likely that any impact is going to be worked out in the future at the operational level, perhaps among local workforce boards or in the American Job Centers, and that's kind of what has been echoed by the states that we've spoken with. So with the continued emphasis, as Brooke was alluding to, at the federal level on better aligning various workforce programs, including SNAP E&T, and making them more job-driven and accountable, we really do expect to see a continued push down to the state and local level on aligning programs, including, obviously, alignment of SNAP E&T with other public programs. Next slide. So what are some opportunities for better alignment of these two programs? So here we have some ideas that we came up with in talking to states. Planning is big. So one benefit of WIOA planning and the process that states went through to develop their state plans was that in some cases SNAP and SNAP E&T agencies were invited to the workforce table in a meaningful way. Some expressed to us that this gave them a first opportunity to include SNAP E&T and the needs of their state SNAP populations to workforce stakeholders for the first time. With states having more opportunities to plan and revisit their state workforce plans, hopefully these conversations will continue on and lead to a growing familiarity with SNAP E&T and more thought about alignment. The next thing is building a system of cross-referral. So there's really an opportunity and a need, particularly as states do take steps to grow skills-based SNAP E&T programs, to create better familiarity among American Job Center staff about the state SNAP E&T program. So who qualifies, what services are offered, who are the third-party partners, what are their specific E&T programs, and so on, so that they can refer people as appropriate. And this goes two ways, of course, as SNAP E&T programs, meaning that the state SNAP E&T agencies and third-party partners, they need to become familiar with the one-stop system and its services to be better able to refer as appropriate. Next, states can think about common assessment by the SNAP E&T agency and its partners, as well as the American Job Center system. Using a common or similar assessment of participants will allow better referral of individuals to the right program, whether it's WIOA or SNAP E&T supported or something else, in a more seamless way. And it will also help with the collection of similar data points on participants of both programs to help compare programs and program outcomes. Another idea is for shared data and data systems. SNAP E&T is now requiring states to report similar outcome measurements for E&T as are required for WIOA. Within states, there should be consideration about sharing data between programs, as well as utilizing common data systems for easy cross-program tracking and enrollment. So both Tennessee and Maryland have moved in this direction. I think it's a good way to go. And it goes to better measurement and reporting by states of these programs, but it also helps participants make more seamless transitions between the different programs and funding sources. Another recommendation is for career pathways to be considered as a framework for alignment. So career pathways is a strategy that states should be pursuing under WIOA, which defines the term. And SNAP E&T, along with TANF, WIOA, Pell, and so on, can be aligned as funding sources to help people move seamlessly up to higher levels of skills without having to take a bunch of complicated steps to move from funding source to funding source. SNAP E&T might, for example, support people in the initial shorter-term skills training where a lot of supportive services are required, and then perhaps people can transition to WIOA or Pell as they either directly after that or after a period of employment so that they can gain additional skills leading to even better employment prospects. And then finally, while TANF wasn't a primary focus of our research, it bears mentioning that alignment of SNAP E&T and TANF can really be a valuable strategy to help low-income individuals advance to self-sufficiency on a smoother path. Individuals who are about to time out of TANF can transition to SNAP E&T in order to begin to gain more skills to improve their employment prospects while receiving related supportive services. And SNAP E&T can serve as a diversion or positive prevention for those who are on TANF to stop the clock on their time-limited benefits or to avoid the clock starting in the first place. So I'll stop there, but as I mentioned, the opportunity and the push from the federal government is really present for better alignment of SNAP E&T and WIOA in a manner that still allows the growth of robust skills-based E&T programs. Most states are still figuring this out, and so there was really little concrete or at least written within WIO plans, state plans, but we hope that some of the recommendations in our paper, many of which I just mentioned, as well as the examples of states like Tennessee, will help many more states as they move this work forward to align E&T and WIOA. So I'll stop there.
Great. Thanks so much, David. Now we're going to turn to a conversation with Denise, Sarah, and Louisa in the States. So we're going to actually start with you, Denise. The first question is, why did your state decide to start building a skills-based SNAP E&T program? And then we'll turn to Sarah, whose state also recently moved in a skills-based direction, to hear what specific steps her state took to do that. So Denise, do you want to start talking about why Tennessee decided to start building a skills-based SNAP E&T program?
Absolutely. Thank you, Brooke. For Tennessee, the decision was quite needful. Our state was experiencing an uptick in economic development opportunity. More and more businesses were relocating to Tennessee, and what we found is there was a significant skills mismatch among our workforce participants. Whereas some people were able to right-size very quickly into the emerging market, others were struggling to really get past being underemployed. And so we started to really take a look across our workforce system to find out where the greatest opportunity was for our workforce participation rates. Because again, as we saw the unemployment rate start to go down, so will workforce participation rates. So we really saw the opportunity with SNAP Employment and Training as a treasure when we looked across our system. So we decided to tackle the skills mismatch by redefining what our E&T program would look like within our workforce system. So we started to look at sector-based strategies. What areas presented the greatest need? What were those industry sectors that we knew were projected to have a tremendous amount of growth, and where do we have the misalignment there with skills and number of workforce participants ready to really fill those opportunities. And so we narrowed those down across the state and started to take the resources that existed at SNAP Employment and Training to align those. So we went to a sector-based program to address skill mismatch, and at the same time, hopefully increase workforce participation. The other thing was to really build a very strong service matrix, so we knew that E&T participants who weren't typically looked at as people who could fill some of the needs for business, we could start to identify what services were needed and what the immediate impact would be. So for us, it was very easy to go to a skill-based program because, again, it satisfied the need of employers, but ultimately it moved the participants from just being underemployed and maybe having these short bouts of just having a job and then losing it and having to right-size again in the economy to directly impact their ability to be adaptable and have long-term successful outcomes with being able to stay with an employer, because we knew these would be high-growth sectors.
Great, terrific. Thank you, Denise. And Sarah, as I mentioned, Maryland has recently started to build a skills-based SNAP ENT program. Can you talk a little bit about why your state decided to do that and some of the specific steps you've been taking to do that?
Yes, absolutely. I mean, very similar to Tennessee's experience. I will actually refer to our governor, and within our current WIOA plan, the number one piece of Governor Hogan's vision for Maryland is around economic development and jobs. And what we have stated in our workforce plan is that our system really needs to successfully partner with business and must evolve to ensure that job seekers receive proper training and opportunities for in-demand careers. So once this was really solidified by our governor and with his vision, we really developed our SNAP ENT program vision around this. And what our vision says is that we want our participants to obtain in-demand skills that result in stable employment or entrepreneurship opportunities. And the way we have decided to do that is really create strong collaborations among a variety of partners to provide our recipients with that job-driven training and support services that will lead to ultimately to careers, family self-sufficiency, and stronger communities. So with that vision as our guiding principle, we really, how do we do this? And we really, and I'll give an example because we just onboarded 6 new third-party partners in Baltimore City. And Baltimore City is really rich with community-based organizations and other entities and the workforce entities there that really provide excellent sector skills training. So when we were onboarding these new partners, we really looked at the in-demand industries in Baltimore City. We did the selections in tandem with our workforce entity in Baltimore City, as well as the workforce funders community. So we really leveraged external expertise that was really kind of out of our realm and pulled them in to help us make decisions on what programs to bring to the table and to start. So we've brought on sector skills training programs that are focused on green jobs, manufacturing, healthcare, warehousing, and construction jobs that will, hopefully lead folks on a good career pathway to achieving family self-sufficiency.
Thanks so much, Sarah. Let's turn to the second question on the next slide, please. I'm going to ask all 3 panelists to describe how your state's SNAP ENT program is aligning with other key skill building initiatives in your state. As we know, a lot of states have their own skill building initiatives that have been supported through state policy, whether that's to promote local sector partnerships or career pathways or integrated education and training opportunities. And so it would be great to hear from each of you how your state SNAP ENT program is aligning with a particular key skill building initiative in your state. And let's start with you, Denise.
Sure. So for us, much like Sarah mentioned earlier, Governor Haslam and his incredible vision for Tennessee to make us the #1 state in the Southeast for high-quality jobs, was a great segue to really start looking at E&T and how it would fit into that mold. So under his Job to 55 initiative, which was, of course, is equipping Tennesseans, 55% of Tennesseans with a degree or credential by 2025 in order to meet the needs of businesses as projected by labor market information, it was critical for us to start looking at what existed and what really were some new initiatives that would happen under the umbrella of Job to 55. And so one of those was Tennessee Promise, which was geared toward graduating seniors being able to go for 2 years to a community college or Tennessee College of Applied Technology at no cost. And the second part of that was one for adults, which would really take adult learners or potential adult learners who had some or little to no post-secondary experience. So for us, this was a great marriage with the SNAP Employment and Training Program around Tennessee Reconnect. It's housed within our Tennessee Colleges of Applied Technology, which traditionally are very agile in their curriculum. They tend to train directly to the needs of employers. Their placement rates are significantly high. So for us, forging a partnership with our Tennessee Colleges of Applied Technology under the Reconnect umbrella was key. So for E&T, it was really leveraging resources because these individuals are able to go back, get an industry-recognized credential, get a degree, and it is provided to them at no cost. But SNAP Employment and Training can provide some of the wraparound of supportive services to ensure completion by the adults. So for us, it fit nicely. The timing was incredible for us, and we're already starting to see some of the impact of having the adult learners go back and really feel comfortable matriculating through these programs, knowing that some of the barriers that maybe they face going in have been removed or minimized by having SNAP Employment and Training there to kind of aid them along their journey.
Terrific. Thanks, Denise. Sarah, how about you? How is your state SNAP E&T program aligning with a key skill building initiative there in Maryland?
Absolutely, and David Kaz actually mentioned it in his opening remarks. We in Maryland have a workforce training program called EARN. It's employment advancement right now, and the program is based on 2 key points. It really places business and industry in the center of developing training programs, and to date, over 500 employers and industry representatives lead about 40 different partnerships around the state, and it's funded through state dollars, which is critical to SNAP E&T. And they're really responsible for defining training needs, developing curriculum, participating in training, and ideally really interviewing successful graduates of the training programs. And these partnerships are in a variety of industries like manufacturing, construction, IT, and healthcare. The other key point about EARN is that it provides important services to underserved populations, including returning citizens, veterans, low-skilled workers, long-term unemployed, and disabled job seekers. So it's really a prime opportunity for our SNAP recipients, quite honestly. And what we have decided to do in partnership with our Department of Labor is really track, because those earned state dollars can be used as cost match in the third-party partner model. So back to my Baltimore City example, we just onboarded 6 new third-party partners, and 4 of those are earned grantees and 2 are sub-grantees. So over time, we will report out to our Maryland state legislature about how much of the state earned dollars are being used as cost match, and then what's the return on investment for the state as far as reimbursement goes. As we look to onboard in more partners around the state and expand statewide, we're encouraging those areas and selecting areas that may also be earned grantees if it makes sense. And that way we can just make these state dollars grow and expand and so forth. And these are industry-led partnerships, so we know that there's the in-demand piece and leveraging those external resources.
Thanks, Sarah. And Louisa, we haven't heard from you yet. Can you tell us how your state SNAP E&T program, which, as I mentioned at the beginning of the webinar, is a model for many other states, has been aligned with key skill building initiatives that are happening there in Washington State?
Sure, and I think I'll answer this question from the WIOA perspective as opposed to kind of the traditional SNAP E&T or BFET. perspective because, as you know, our BFET program here in Washington State is very robust and includes very strong partnerships with both the community college system and other local providers in order to help individuals get the skills they need in order to improve their opportunities for success economically and encourage self-sufficiency. And what we're trying to do now from the WIOA perspective, and we are one of those 10 states that did include our SNAP ENT or BFET program in our WIOA combined plan, is to bring that program more to bear within the broader workforce development system, to raise the visibility about what resources are available, what programs and services and supports, and how the funding can impact low-income individuals in particular on their pathway to economic security. And so in Washington State, with our WIOA work, the primary framework would be career pathways, and a strong vehicle for us is our Integrated Basic Education and Skills Training Program, otherwise known as IBEST. And the way that BFET can align with that, and already does, but we're looking at making this more significant and building the infrastructure around this, is to provide the needed supports for low-skilled individuals that are also low-income to move into earning college-level credits, certificates, and degrees that lead to significant economic results. And so in Washington State, we also focus in on research that came out of Washington, but it is used nationally, known as the tipping point research, which indicates that 1 year of college credits and a certificate or degree will provide a significant economic bump for an individual. And so in aligning our SNAP ENT BFET program with programs like IBEST, we can help low-skilled and low-income individuals move to college credit certificates and degrees more quickly, and the program has been shown in terms of research to be effective. So how we can better pair those and increase referrals, increase capacity, increase participation in a program that we know really works. The other thing is that in Washington State, we're focusing on work-based learning and sector-based incumbent worker training, and how we can upskill existing workers and create openings for entry-level positions and continue a pathway along that career and wage progression spectrum over time by engaging business and being intentional about the way that we support both business and individuals that are job seekers or existing workers to continue along that pathway. In terms of WIOA and BFET, it's very much an opportunity right now to move the program out of its kind of parallel existence to the broader workforce development system, make the workforce centers, which is what we call our America's Job Centers, more aware of the resource and how to utilize it. And then also because we do have not just the colleges as partners and providers within our BFET program, it also is going to provide the opportunity for local community-based partners to strengthen the relationships with the workforce development boards in their areas and have a better opportunity to jointly serve and leverage resources for individuals.
Thanks so much, Louisa. Sticking with you, and you already started on this, but feel free to add. I'd like to move to the next question, which, next slide please, is specifically what steps your state is taking to align SNAP ENT with WIOA. So you talked a little bit about some of those opportunities already and the fact that Washington did include BFET in its WIOA state plan. Are there other top opportunities or challenges that you want to spend a little time talking about specifically as it pertains to WIOA implementation and alignment with BFET?
Yes, there are certainly opportunities, but challenges as well. And I think that the greatest opportunity that we have right now is to create a system that is more aligned and aware of the assets and resources that are available to the individuals that we oftentimes jointly serve. And in Washington State, David did a great job of highlighting some of the ways that there are opportunities for WIOA and TANF and BFET to be more aligned. And it's very easy to kind of express those high-level ideas around this is what needs to happen, but as we all know, getting to the place where we can truly implement that is another story. So every time we express a high-level idea like common assessment or data sharing, there's a lot of work that goes on behind the scenes. And so what's happening in Washington right now, very intentionally and across every WIOA partner, both those that are named in the Act and our combined plan partners, as well as local stakeholders, we're working to create the operational elements that will allow us to get to that place where we can reduce redundancy in terms of data and intake information for participants that are jointly served. We're working to really flesh out what does integrated services delivery mean, and beyond the fact of just we're jointly serving, but how do we look at an individual and their pathway through the workforce development system beyond the door that they entered, to recognize that even if they exit, say, a TANF or a BFET program, that there are other opportunities and resources that exist, and that we want to create the true seamless pathway where behind the curtain we have figured out how to make that funding blend, as well as the services, and making sure that all those resources are available. And all of those operational elements just take a lot of time, and I have to say that Washington, I think, is in a good place right now with multiple partners at the table, and it's really great to have BFET there because it's not a well understood program across the broader workforce development system. So the Act is going to give us the opportunity to raise that visibility and bring that program more into the kind of well-known workforce development system options.
Thanks so much, Louisa. That's really helpful to hear, given the history of BFET as a model program in Washington, and to hear how some of those things can get operationalized in terms of aligning with WIOA on the ground level. Denise, how about what's happening in Tennessee in terms of the steps your state is taking to line SNAP ENT with WIOA? Can you share with us some of the top opportunities and challenges, as well as some of the key pieces that are happening on the implementation front at the ground level?
Absolutely. I think here in Tennessee, we are certainly, we consider ourselves fortunate because as the Labor and Workforce Development Agency, we kind of quarterback the whole WIOA process here in our state. So having SNAP employment and training under roof, as well with the other titles, our adult, dislocated worker, and youth, it really helps us focus from the very inception on how we will incorporate SNAP employment and training in a very meaningful way into our service delivery. And also having the responsibility for overseeing the American Job Centers, we've operationalized a lot of the strategic initiatives we identified in our plan, and we're still working toward putting some of those in action as well. And the biggest piece has really been the inclusion of our local workforce development boards, having them at the table from the very beginning. We're looking at what we're going to, how we're going to incorporate SNAP employment and training into our American Job Centers. What does that look like around common intake, common assessment, orientations, both virtually and physically in the one-stop. We have launched our shared data system. We went with the virtual one-stop a couple of years ago, and we have a separate SNAP employment and training module built within that system. And it seems minor, but it's very meaningful in that we're able to capture a tremendous amount of data for these participants when they're entering our system, and that's shared among partners. Because one of the things that is a barrier itself is just programmatic access. So if I have to fill out duplicate forms, if I have to keep telling someone what an issue is, then that really prolongs my ability to access the system and get into a core component or activity that's going to get me skills, get me credentialed, and get me to an employer. So just having access to all of that information among our partners has been vital. We also have adult education under roof. So how we move participants who may be struggling to just get a high school equivalency is also an added dimension that we have. So being able to have those pieces together for us has certainly been a tremendous opportunity, and you certainly will see some of that in our WIOA combined plan. I think some of the challenges are certainly to create additional champions for SNAP employment and training. As someone alluded to earlier, it can be cumbersome because it's not a familiar element when you start to really talk in the workforce space. So I'm happy to see that that's changing. And in Tennessee, we smile when we go out now because there's someone else carrying the argument for employment and training now. It's not just us saying that it works. Others are starting to see how this system complements the workforce system from a broader perspective. Around the Tennessee Reconnect, we're able to sit down with the Tennessee Higher Education Commission and say, listen, we're directly going to impact the number of completers under this program, under the governor's vision, because we have E&T who can ask for those complementary pieces. So those opportunities still exist for us. Some of them have to be realized. As you know, WIOA is a big act, and there's a lot that's contained within it. But we feel great about our position here in Tennessee. We feel great about the energy that's certainly been created around SNAP employment and training because it has been an underutilized resource in our state, and we're hoping to change that narrative as we move forward.
Thanks so much. So now I'd like to take a little bit of time to get some questions from the audience. So if folks have questions that you haven't already submitted, please feel free to submit those through our questions portal on the webinar. David, I'm going to start with you because I think there's varying levels of knowledge on SNAP E&T among participants, and folks I've gotten a few questions about how SNAP E&T funding works, and I know it can be complicated, but can you just give folks a sense of some of the different key funding streams for SNAP E&T and how they can be used to support partnerships with third parties?
Sure, I'll just give a very high-level overview. So the FNS, the Food Nutrition Service of USDA, makes, I believe it's about $90 million available currently in the current fiscal year for what are called 100% grants. And those are funds that can be used for basically a variety of things for states to support their SNAP E&T programs as well as administer those. The one thing that 100% funds cannot fund are sort of direct participant reimbursements for things like transportation and child care and so on. Again, that's $90 million for the entire country. So you can imagine, just based on simple math, that it's pretty limited dollars. That said, some states are not using all of their 100% funds, in which case they're giving them back to the feds and they can be reallocated. So as we're trying to make sure that states are using those funds effectively. Now, FNS also makes available what are called 50-50 funds as well, and these funds can support all the things I mentioned as well as direct participant reimbursements for supportive services that are directly related to participating in the SNAP E&T or the employment and training components. And this is where there's the potential for growth. The 50-50 funds reimburse states or third-party providers via states 50 cents for every dollar expended on allowable components for individuals who are qualified for the program. So that's really where the potential lies because currently those funds are uncapped. So states can really grow, and where initially states started out thinking, okay, if we're going to get 50% match, we have to put up more money to get reimbursed. And so, states might be unwilling to do that. However, with the third-party model, states can really partner with organizations, community-based organizations, community colleges that are already investing resources in qualified activities and get reimbursed 50 cents on the dollar by contracting with those agencies and pass through the match to those agencies so that they can expand their services to serve more individuals on SNAP.
Great, thank you so much. A question for each of the folks in the state. There's been a question about the types of support services that are being provided to participants through SNAP E&T. I know several of you mentioned the support services piece and combining that with the education and training opportunities. I guess we could start maybe with Sarah and then Denise and Louisa if you all each want to just address the types of supportive services that you're providing to SNAP E&T participants.
Sure, yeah. I mean, some of the basic ones that have already been mentioned, transportation, childcare, and there is, and I believe this resource will be shared, but there's an excellent chart in the SNAP ENT FNS put it together. It's a toolkit that really outlines quite nicely the different types of allowable support services that, participant reimbursements that can be, that are allowable. So those can include such things as uniforms, tools. I'm actually pulling up our list right now so that I could help you out with that. Books, again, yeah, clothing that's related to the employment and training, and that's the piece that's really crucial, is that these participant reimbursements have to be reasonable and they have to be directly related to the program itself. Some other things can be medical services if it's related, and I don't know, my colleagues can add on others if yep.
Great. And Louisa and Denise, do you have anything to add specifically about the support services that you're providing to SNAP ENT participants in your state?
I think, Brooke, the list, as Sarah mentioned, is pretty standard, although there's some caveats for additional opportunities for supportive services. I think the message really is to help connect it to the larger system, because that's still a virtual unknown for some of the folks in the workforce space, is that it's a tremendous opportunity to stretch and leverage and build capacity for some of the other programs using the supportive services from SNAP Employment and Training to help serve more individuals in this space.
Great.
And I would agree with what the other panelists have expressed, but I would also defer to David to add some supplemental information because he's such an expert on BFET here in Washington State.
Well, yes, in terms of supportive services, honestly, I think Sarah covered all the main ones. Definitely reasonable, related to the program. In other words, you can't just be a housing provider and providing housing, but in some instances, housing that is temporary and supporting somebody through an employment and training program that allows them to complete would be allowed. But I agree. I think probably the best resource is for people on the webinar to go to the FNS website where all those services are listed out.
Great, thank you. So one of the other questions that we've gotten from a few different audience members is around how referrals get made to a SNAP ENT program, and if there is training of workers both within the WIOA system at the American Job Centers and also workers who are doing SNAP case management to help referrals be made to SNAP ENT programs. Would anybody like to address the referral system and also the training provided to folks who are working with clients to make referrals and know about the program and make that smooth transition?
Sure, this is Sarah from Maryland. We actually have a unique initiative in Baltimore City. Again, that's where we've focused sort of our first round of expansion, and this was in alignment with a bill that was passed during our recent legislative session that really focuses on non-custodial parents. So for this particular initiative, and it's probably my colleagues can talk on a broader sense about referrals, but we are working closely with child support, which is housed within our state agency, but to really work with those non-custodial parents that, and many of them are on SNAP or are eligible for SNAP and really want to move forward with their lives and gaining meaningful employment, education, and training. So if they, those folks are interested, we're actually going to do it through our online performance IT system. We can make electronic referrals that way, so they'll be referred directly to those third-party partners in Baltimore City, where the partner would take over from there as far as a more in-depth assessment and to determine really if the program is a good fit for that individual. So that's just a little bit about what we're doing in Baltimore City.
Great. Denise or Louisa?
Sure, this is Denise. In Tennessee, we're a little unique in that our eligibility agency, Department of Human Services, obviously sends the referrals over to us. This is a strictly automated process. So in our virtual one-stop system, our staff in the American Job Centers, when they report to the office, they're able to log in and get all of the automated referrals that come over the night previously and can begin interaction with the ENT participants that are referred over. We are looking to expand access to our virtual system to our third-party providers. So our CBOs and also some of our folks in post-secondary would be able to access the system to share services. So as those services are rendered, we will be able to get a very holistic view of everything that's being done for the purposes of consolidating case management. We're also looking at that being an automated process as well. And we are looking at ways to refine the reverse referral process. So those that are coming from post-secondary back to us and obviously verifying that information with our eligibility agency. And we're going to also do a little of data sharing and accessibility through ourselves and Department of Human Services, so we will have access to each other's system to expedite the verification of someone receiving ENT so they can very quickly be connected to services.
And Louisa, is there anything you want to add about Washington State's process?
Yes, actually, and while we do have a very strong existing reverse referral system at this time, we also are working to provide information and training to our Department of Social and Health Services staff that upon initial engagement they can share more information about basic food employment and training so that they may become engaged. And then additionally, as part of the WIOA partnership, one of the things we're looking at is how do we potentially address categorical eligibility, and looking at when an individual enters the workforce or workforce development system and provides enough basic information to potentially be eligible for food benefits, that we get tickled and are aware of that and can start an application. And then as well, when we get applications for food, that we share that information with workforce development and the individual to let them know what they may be eligible for. And that's in the planning phase still, and figuring out how we can do data share and also the technology around that. But the concept is that we would like to find more ways that when we have information about an individual that may be eligible, that they have the information so that they can access the resource.
Great, thanks. So I'm going to ask one more question from the audience because I do want to save time to wrap up and get your final thoughts. So the final audience question that I'm going to ask, and I'm going to start with you, David, and I've gotten this question from more than one audience member, is whether it's possible for local community organizations or WIBs to get engaged in skills-based SNAP ENT along with their local SNAP agencies, even if there isn't yet state activity at the state level around skills-based SNAP ENT. Can you share with folks kind of the process for starting pilots and the role that the state SNAP agency plays in that?
Sure. Well, obviously, you need the state in order to move forward. A lot of states are county administered, in which case the county can be a big champion as well. So I think probably the best bet is to, and actually I was saving this point for last, so I'll just say it now, which is, if you're a community-based organization or a community college and you really see potential in this program, is to really think about finding a champion at the state level. We have a lot of champions on this webinar, and they were really instrumental in their states in moving things forward. And in that case, think of somebody who is at your state SNAP ENT agency, somebody in the governor's office. It could even be a state legislator who is passionate about workforce issues, is passionate about helping people move ahead socioeconomically in a socioeconomic way through more skills and training, and get as informed as you can about the SNAP ENT program, its potential in your state. You may come with data, statistics about the numbers of people who are on SNAP in your state and their skill levels. I think that would be helpful. You can come with examples from other states of what they're doing and advances they're making. including, the amount of dollars that they may be drawing down, the amount of third-party partners they have, how many people they're serving. There are resources out there, so find counterparts in agencies in other states that are doing this and come armed with information about the potential, and really try to find some champion that can help push this forward at the state level, and keep those conversations going, because it can take a while for things to move.
Great, thank you. And so as a kind of final question, I'd like to ask each of the panelists to share the 1 or 2 recommendations you have for folks in other states who want to see their SNAP ENT programs grow and become an integral part of their workforce system. And it sounds like David just shared his final thought with us on that. David, do you have anything else you want to add to that, or should we turn it over to the other panelists?
I think that was my primary thought, so let's go with one of the other panelists.
Okay, Denise, why don't you get us started?
Sure. I would say certainly is to look for your stakeholders, and David mentioned that to some degree, is look at those who are like-minded in their approach to impacting workforce in their areas. One critical stakeholder for us that quite frankly was underutilized in the past was our boards. And so we've recently put contracts in place that our workforce boards are an integral part of SNAP employment and training across the state. So that buy-in really helps when you're pushing the message, because who better to know what the needs of the local communities are other than the local board. So we're hoping that as a state that we can very organically have those relationships, even down to the third-party partnerships, happen between the local boards and community-based organizations. So definitely get your stakeholders engaged. Show them the benefits of the program, because a lot of folks want to be involved, they just simply don't know how. And it's not as cumbersome as it seems. Yes, it has some nuances, but definitely help people to understand the benefit, and more importantly, how it can advance a participant moving through the system and getting the skills, the qualifications, the training they need to right-size in a very emerging sector-based market across the nation.
Thanks so much, Denise. How about you, Sarah? What are the 1 or 2 things that you would say to those in other states who want to see their SNAP ENT programs grow and become a critical part of their workforce system?
Absolutely, and I think this was mentioned earlier, but for the SNAP agencies to really take a look at their how they're using their 100% funds. It's a limited amount of money. It's based on a formula allocation, and for Maryland, ours was roughly around $1 million, and historically we use that in our local departments of social services to run very small programs that were really based on, just soft touch services. So we took a critical look at how we're using our 100% funds and have a, it's kind of a balancing act over the next handful of years of trying to draw in the 100% funds so that we're using it centrally to build our capacity to successfully operate and administer the third-party partner model. As we've heard several times, this model is the way to grow your SNAP ENT programs, and leveraging external partners are essential to that model. So those 100% funds can be used to build, as mentioning, staffing to manage the contracts, the monitoring, all of the pieces that FNS require to operate that model. It can be used to seed new third-party partners to jumpstart them. It can be used to innovate and to potentially evaluate what you're doing, and trying to map out, even having some mapping done where you're looking at where your resources are around the state. So that's I think one takeaway is that we've learned is looking at how to repurpose those 100% funds.
Thanks so much. And finally, let's close with you, Louisa. What is the 1 or 2 recommendations that you would make for folks in other states who want to move their SNAP ENT programs toward a skills building effort and align it with other parts of their workforce system?
Coming from the perspective of that broader workforce development system, I would say in considering WIOA, the Workforce Innovation Opportunity Act, the opportunity is now, both at the state and local level. If you're not at the table, get to it, be a voice, and share your expertise and bring that to bear. Be willing to invest in your workforce development system by sharing your information and potentially jointly training workforce development partners regarding your program and even their direct service staff in order to increase referrals for you, infrastructure for the program overall, and capacity for the program in general within your state. But the opportunity really is now that WIOA has created for us to bring your SNAP ENT program into the broader workforce development system as an essential partner.
Terrific. So with that, I do want to let folks know that the two policy briefs that David provided summaries of are available online. Can you skip to the next slide, please, Sylvia? So here are the URLs for each of those reports. We will also be, I believe, sending out a copy of the webinar slides and recording to folks who participate on today's webinar, so you should have this available to you if you're interested in looking at these two recent reports that we've put out. And then on the next slide is listed contact information for everybody who spoke today, so feel free to get in touch with folks if you have additional questions. I know there were a lot of questions during the audience Q&A, and we just don't have time, unfortunately, to get to them all, so feel free to follow up. And with that, I'd really just like to thank Denise, Sarah, Louisa, and David for all of their time today, and I'd like to thank the audience for your time spending the past hour with us learning about developments in skills-based SNAP ENT. We look forward to sharing more information on this as we continue to work in this area, and please keep checking back with both National Skills Coalition and Seattle Jobs Initiative as we continue this work. Thank you.